Hello everyone, welcome to ITLS Academy. This is your mentor Dr. Shamaita Basu, and in this session we will be moving on to the next topic of medical coding. So as we can see, the codes are running from I00 to I99 and it refers to diseases of the circulatory system. Okay, so let's first see what are the different subcodes that we have under diseases of circulatory system. So it starts right from acute rheumatic fever I00 to I02. Then we have I05 to I09, chronic rheumatic heart disease. So here I will again highlight for you, because as you can see, after I02 we are directly having I05. So 3 or 4 nahi hai. Okay. Then I10 to I1A we have hypertensive diseases. Then I20 to I25 we have ischemic heart disease. यहाँ पर भी chronological order is not being maintained. I26 to I28 we have pulmonary heart disease and diseases of pulmonary circulation. I30 to I5A we have other forms of heart disease. I60 to I69 we have cerebrovascular diseases. I70 to I79 we have diseases of arteries, arterioles and capillaries. I80 to I89 we have diseases of veins, lymphatic vessels and lymph nodes which are not elsewhere classified. And last but not the least, I95 to I99 we have other and unspecified disorders of the circulatory system. Okay, so again I will highlight it for you. Therefore I89 के बाद directly आ रहा है I95, so that is an exception. I5A के बाद I60 आ रहा है. Okay, I28 के बाद डायरेक्टली आ रहा है I30, 29 नहीं है बीच में. और यहाँ पे I1A के बाद डायरेक्टली आ रहा है I20. Okay, so these are the exceptions that you need to remember. Moving forward to the next slide. So the first disease that we need to talk about when we are talking about diseases of circulatory system will be acute rheumatic fever. So the codes are running from I00 to I02. So let's see what they're saying over here. So it is an inflammatory disease that can develop after an untreated or inadequately treated streptococcal throat infection. So streptococci is a very common group, or rather common species of bacteria which are known to cause various these type of cough and cold. It primarily affects children and can lead to serious complications involving the heart, joint, skin and brain. Symptoms will include fever, joint pain and swelling, skin rash and involuntary muscle movements. Treatment will focus on eradicating the streptococcal bacteria with antibiotics, managing inflammation with anti-inflammatory medications, and monitoring for any potential long-term damage to the heart valves. Okay, moving on to the next group of subcodes, I05 to I09, which refers to chronic rheumatic heart diseases. Okay, so again very important. So it is a long-term consequence of acute rheumatic fever characterized by permanent damage to the heart valves. This condition results from the inflammation and scarring caused by repeated episodes of rheumatic fever, which primarily affects the mitral and the aortic valves that are present in the heart. Symptoms will include shortness of breath, means breathing distress, respiratory distress will be there. Fatigue means the person will feel very tired and exhausted all the time. Chest pain will be there and irregular heartbeats. Management will typically involve medications to alleviate symptoms, prevent further valve damage, and sometimes surgical interventions such as valve repair or replacement to improve heart function. Okay, moving on to the next set of subcodes that we have for diseases of circulatory system. So here, as we can see, the codes are running from I10 to I1A. Okay, so it will be referring to the hypertensive diseases. So these are the various subcodes that we have under this. So let's see. I10 will be essential or primary hypertension. Then we have I11, which will be hypertensive heart disease, means heart disease as a result of hypertension, increased blood pressure. Okay, then we have I12, hypertensive chronic kidney disease. Then we have I13, hypertensive heart and chronic disease. Then we have I15, secondary hypertension. Then we have I16, hypertensive crisis. And then we have I1A, that is other hypertensions. Okay, तो यहाँ पे भी एक chronological order का exception हुआ है. That is this one. I13 के बाद directly आ रहा है I15. So there is no I14. Okay. Okay. So now starting with the most important disease under this group of subcodes, that is I10. which stands for essential or primary hypertension. So if the blood pressure is 140 by 90 or higher, okay, we all know that the normal blood pressure is 120 by 80. Normal, or rather the ideal blood pressure will be 120 by 80. Okay, so now what do you mean by 120 by 80? It is the millimeter mercury, that is the unit for blood pressure. Means the pressure exerted by the blood on the walls of the blood vessels when the blood is flowing through the blood vessels. Okay, that is basically the definition of blood pressure. Now what do you mean by this 120 by 80? So when the heart is like all the time, basically when the heart is pumping, because heart is an organ which is continuously working, heart and brain, isn't it? These are the two organs which are continuously working, they're never resting. If they're resting, means that person will most probably die. 95% chances that the person will die. So heart and brain are the two most major important organs of the body which are continuously working for us. Now whenever the heart is pumping the blood, it is either contracting or relaxing. These are the two options. Okay, so now this 120 by 80 is decided by when the heart is relaxing and when the heart is contracting. Okay, and the terms for that are systole and diastole. Okay, so systole means when the heart is contracting. Heart means what? Heart means the heart muscles, because heart is nothing but a ball of muscles. It is an organ made up of huge muscle supply, cardiac muscles. Okay, so when the heart is contracting, it is known as systole. When the heart is relaxing, it is known as diastole. Okay, so obviously अगर normal sense से भी हम लोग सोचेंगे तो heart जब contract करेगा तब pressure ज़्यादा होगा, blood pressure ज़्यादा होगा obviously, और heart जब relax करेगा यानी कि जब diastole होगा तब pressure कम होगा, isn't it? So 120 by 80 में ज़्यादा क्या है? 120 है, so that means तब heart हमारा contract कर रहा है, means systole, और 80 मतलब कम है तो तब हमारा हार्ट रिलैक्स करेगा, मतलब कि डायस्टोल. ओके, सो 120 विल बी द सिस्टोलिक हार्ट प्रेशर, सॉरी ब्लड प्रेशर, एंड 80 विल बी द डायस्टोलिक ब्लड प्रेशर. ओके, ऑलवेज रिमेंबर लाइक दैट. नाउ हाइपरटेंशन हम कब बोलेंगे? व्हेन द ब्लड प्रेशर विल बी आइदर 140 by 90 और मे बी मोर देन दैट. इट कैन बी मोर देन दैट ऑल्सो. ओके, सो उसको हम आइडियली हाइपरटेंशन बोल के उसको हम डिफाइन कर सकते हैं. सो हाई ब्लड प्रेशर यूजुअली हैज नो सिम्टम्स. इट कैन हार्म द आर्टरीज एंड कॉज एन increase in the risk of stroke, heart attack, kidney failure and blindness. And you know this sentence over here is very important. High blood pressure usually has no symptoms, and that is the most dangerous thing about blood pressure, कि जब भी ब्लड प्रेशर बढ़ता है इंसान को पता नहीं चलता है. ठीक है, क्योंकि ऑब्वियसली जो दिस थिंग इज समथिंग आई ऑलवेज टेल कि व्हेन डू वी गो टू द डॉक्टर? हम कब दवाई खाना जाते हैं, कब हम हॉस्पिटल्स जाते हैं, डॉक्टर को दिखाने जाते हैं? व्हेन देयर इज सम प्रॉब्लम इनसाइड आवर बॉडी, isn't it? If a person is normal, then obviously he or she will not keep on checking her blood pressure now and then, isn't it? तो उसको पता कैसे चलेगा कि उसका ब्लड प्रेशर हाई हुआ है? क्योंकि उसको तो कुछ दिक्कत ही नहीं हो रहा है. देयर इज नो प्रॉब्लम, देयर इज नो सिम्टम इन द बॉडी. सो जब तक पता चलता है कि हाई ब्लड प्रेशर हो गया है तब तक बहुत लेट हो जाता है. ओके, जो भी ये सारे ऑर्गन्स है, जैसे स्ट्रोक का रिस्क हो गया, हार्ट अटैक का रिस्क हो गया, किडनी फेलियर का रिस्क हो गया, एंड इवन ब्लाइंडनेस. ओके, वाई ब्लाइंडनेस? बिकॉज हाई ब्लड प्रेशर मीन्स व्हाट? ईच एंड एवरी ऑर्गन का जो अलग अलग ब्लड सप्लाई है वो भी बढ़ रहा है, ऑक्यूलर प्रेशर बढ़ रहा है, आंख का प्रेशर बढ़ रहा है. So as a result, जो the blood vessels of the eyes, they can burst open, they can rupture, which can lead to blindness. Okay, so इसलिए hypertension is something which is very very dangerous. Okay, because it's something which is hidden, and for a long time the patient actually has no idea that he or she has hypertension. Okay, so it is currently defined as when systolic pressure is consistently greater than 140, and this word again over here is very important. Consistently, I will just highlight it for you. Consistently मतलब क्या? लगातार. ओके, क्योंकि ब्लड प्रेशर जो है ना वो हमारी बॉडी में फ्लक्चुएट करता रहता है. ठीक है, मेनली कब होता है? जब कोई इंसान सोचो स्ट्रेस में है. ओके, कुछ हुआ है, कुछ घटना घटी है, कुछ दुर्घटना घटी है, एज अ रिजल्ट ऑफ विच द पर्सन इज एन स्ट्रेस, और मे बी द पर्सन इज हैविंग एंजाइटी अटैक, पैनिक अटैक. तो उस टाइम पे जाके अगर हम ब्लड प्रेशर मापेंगे तो ऑब्वियसली उसका ज्यादा ही आएगा. Isn't it? It's a normal response of the body. तो इसका मतलब ये नहीं कि उसको हम हाइपरटेंसिव बोल देंगे, नो. लेकिन अगर एक इंसान का हम देख रहे हैं लगातार जब भी हम माप रहे हैं ब्लड प्रेशर उसका आ रहा है 140 से ज्यादा, सिस्टोलिक वाला मतलब ऊपर वाला, जो 120 आना चाहिए वो 140 से ज्यादा आ रहा है लगातार, एज इन व्हाट? एटलीस्ट 5 to 6 times the pressure has to be checked. और अगर देख रहे हैं कि all those 5 to 6 times the pressure is coming to be 140 or even more than that, that means that person is hypertensive. और डायस्टोलिक प्रेशर यानी कि जो नीचे वाला है जो 80 होना चाहिए, वो अगर कंसिस्टेंटली 90 mm मर्करी से ज्यादा आ रहा है, 90 mm या उससे भी ज्यादा, ठीक है. सो दिस इज बेसिकली द डेफिनेटिव क्राइटेरिया फॉर हाइपरटेंशन. कब हम बोलेंगे कि इसको हाइपरटेंशन है. ओके या तो उसका डायस्टोलिक प्रेशर 140 से ज्यादा आना चाहिए, 140 या उससे ज्यादा आना चाहिए लगातार, या फिर उसका जो डायस्टोलिक प्रेशर यानी कि नीचे वाला प्रेशर है वो आना चाहिए 90 या उससे भी ज्यादा लगातार, तब जाके उसको हम हाइपरटेंसिव बोल सकते हैं. ओके Okay, so moving on to the next important code that we have over here, I11, which stands for hypertensive heart disease. So it refers to the complications and structural changes in the heart resulting from chronic high blood pressure. So chronic hypertension जिसको होगा उसको हो सकता है या फिर उसको like that person will be at more risk of developing hypertensive heart disease. Okay, so chronic मतलब क्या, जो बहुत सालों से है. सोचो एक इंसान को 10 साल से 15 साल से hypertension है और वो मेडिसिन भी ले रहे हैं हाई बीपी का, तब जाके उसको हो सकता है कि 10 साल बाद या 15 साल बाद जाके उसको हाइपरटेंसिव हार्ट डिजीज हो गया है. ओके prolonged hypertension can lead to conditions such as left ventricular hypertrophy, heart failure and ischemic heart disease. heart failure मतलब क्या है हम सबको पता है, जिसको हम AMI बोलते हैं या फिर acute myocardial infarction बोलते हैं. ischemic heart disease मतलब क्या, heart disease due to low oxygen supply in some places of the heart, उसको हम बोलेंगे इश्चेमिया. और लेफ्ट वेंट्रिकुलर हाइपरट्रॉफी मतलब क्या, कि हार्ट का जो लेफ्ट वेंट्रिकल है, आई होप यू ऑल नो दैट द हार्ट हैज 2 ventricles and 2 auricles, isn't it? So जो लेफ्ट वाला वेंट्रिकल है among the 2 ventricles, उसमें हाइपरट्रॉफी हो सकता है. हाइपरट्रॉफी मीन्स इंक्रीज इन द नंबर ऑफ सेल्स. ओके Symptoms will include chest pain, shortness of breath, fatigue and swelling in the legs. Management will involve controlling blood pressure through lifestyle changes, medications and regular monitoring to prevent further cardiovascular complications. Okay. Moving on to the next important code that we need to know about, that is I12, which stands for hypertensive chronic kidney disease. So let's see what they're saying over here. Hardening of the kidney due to infiltration by fibrous connective tissue, which is known as fibrosis, usually caused by renovascular diseases or chronic hypertension. Means घुमा फिरा के वही सेम चीज कि chronic hypertension के वजह से kidney failure हो सकता है. ओके ठीक जैसे हार्ट फेलियर हो सकता है वैसे किडनी भी इफेक्ट हो सकता है. नेफ्रोस्क्लेरोसिस लीड्स टू रेनल इश्चेमिया, स्क्लेरोसिस और हार्डनिंग ऑफ द किडनी ड्यू टू रेनोवैस्कुलर डिजीजेस. So what is nephrosclerosis? It is hardening of the kidney due to ischemia of the kidney. Okay. Next is I13, that stands for hypertensive heart and chronic kidney disease. So it is a condition, chronic kidney disease का जो abbreviation है वो है CKD. It is a condition where prolonged high blood pressure causes damage to both the heart and the kidneys. The increased workload on the heart leads to hypertensive heart disease, which can result in left ventricular hypertrophy and heart failure, something I've already mentioned in the previous slide. Concurrently, along with that, the kidneys suffer from reduced blood flow and increased pressure, leading to CKD, characterized by gradual loss of kidney function. Management focuses on controlling blood pressure through medications, lifestyle changes, and monitoring kidney function to prevent further deterioration and complications. Moving forward to the next important code that we have over here, I15, which stands for secondary hypertension. So it is high blood pressure caused by an underlying medical condition, unlike primary hypertension, which has no identifiable cause. Conditions leading to secondary hypertension will include kidney disease, adrenal gland disorders, because adrenal gland are situated exactly on the top of kidney. Okay, 2 glands on 2 kidneys. Okay. So adrenal gland be affected होंगे and certain medications. It is often more severe than primary hypertension and can be resistant to treatment. मतलब treatment भी उसका नहीं हो सकता है. Identifying and addressing the underlying cause can significantly improve blood pressure control. Next important disease that we need to know about is hypertensive crisis, the code for which is I16. So it is a severe and sudden increase in blood pressure that can lead to serious health complications, and it is characterized into 2 types. What are they? Hypertensive urgency and hypertensive emergency. So urgency में क्या होगा? When there is no immediate organ damage, and emergency में there will be acute organ damage, multiple organ damage rather, heart, brain and kidney. Symptoms will include severe headache, shortness of breath, chest pain, and vision problems. Immediate medical intervention is critical to prevent life-threatening outcomes. Okay. Moving on to the next important codes that we need to know about, running from I20 to I25. So they refer to the ischemic heart diseases. Okay. So let's see what are the different subcodes that we have over here. So I20 will stand for angina pectoris, which is very important and very common also. I21 will stand for acute myocardial infarction, that is AMI, something I've already talked about before. I22 will stand for subsequent ST elevation and non-ST elevation myocardial infarction. So this ST is basically the, the waves of the ECG, graph that we have. It consists of PQRST. 5 waves are there, P, Q, R and ST. So this ST wave का elevation लेके या problem लेके जो conditions है, those are this. Okay. I23 will stand for certain current complications following ST elevation and non-ST elevation myocardial infarction within the 28-day period. Then I24, which stands for other acute ischemic heart disease, and I25 stands for chronic ischemic heart disease. So among these subcodes, the two most important diseases rather that we need to know about will be angina pectoris and acute myocardial infarction. Okay, so first we will be talking about angina pectoris, the code for which is I20. So it is a disorder characterized by substernal discomfort due to insufficient myocardial oxygenation. Means हार्ट को जितना ऑक्सीजन चाहिए उतना ऑक्सीजन उसको मिल नहीं रहा है, ठीक है, लेकिन उसको हम इश्केमिया भी नहीं बोल सकते. इश्केमिया मतलब जब ऑक्सीजन एकदम ही नहीं जा रहा है या फिर बहुत ही कम जा रहा है, ऑलमोस्ट नेग्लिजिबल ऑक्सीजन सप्लाई और नो ऑक्सीजन सप्लाई, तब उसको हम इश्केमिया बोल सकते हैं. लेकिन एंजाइना पेक्टोरिस में क्या होता है कि उतना सीवियर कंडीशन पहुंचता नहीं है, ठीक है, ऑक्सीजन सप्लाई जो है वो थोड़ा कम होता है बस, तो इसलिए उसको हम डिक्रीज्ड या इनसफिशिएंट ऑक्सीजनेशन बोल सकते हैं, बट नॉट इश्केमिया. ओके, एंड व्हाट डू यू मीन बाय सबस्टर्नल? बिकॉज इट ऑकर्स just below the sternum. Okay, I hope you all know what is sternum and where it is located. So just below the sternum वो जो discomfort या pain जो भी होता है वो होता है, इसलिए it's substernal. Okay. So it is a heart condition marked by paroxysms of chest pain due to reduced oxygen to the heart. It may feel like pressure or a squeezing pain in your chest. It may feel like indigestion. You may also feel pain in your shoulders, arms, neck, jaw or back. Angina is a symptom of coronary artery disease, which is abbreviated as CAD, and it is the most common heart disease. Okay, जो coronary artery disease है वो ज़्यादा से ज़्यादा किन में दिखता है? Overweight people. ओके, ओबीज पीपल, जिनका लाइफस्टाइल एकदम सही नहीं है, बहुत जंक फूड खा रहे हैं, फास्ट फूड बहुत ज़्यादा खा रहे हैं, कोई भी फिजिकल एक्सरसाइज नहीं है. ओके, उसके बाद फिर बहुत ज़्यादा स्ट्रेस है, एंजाइटी का प्रॉब्लम है, या फिर कोई दूसरा कोमोबिडिटी है जैसे कि हाइपरटेंशन हो गया, डायबिटीज मेलाइटस हो गया, हाई ब्लड शुगर हो गया, ठीक है, या फिर कैंसर है, तो इन लोग के केसेस में CAD इज मच मोर कॉमन, कोरोनरी आर्टरी डिजीज. ओके, और ये जो यहाँ पे सेंटेंस है ना, इट मे फील लाइक इंडाइजेशन, दिस इज समथिंग वेरी इंपॉर्टेंट. इवन व्हेन वी टॉक अबाउट हार्ट फेलियर, आई विल जस्ट हाईलाइट इट फॉर यू. इवन व्हेन वी टॉक अबाउट हार्ट फेलियर और हार्ट अटैक जिसको हम आम भाषा में बोलते हैं, उसमें भी क्या होता है, मोस्ट ऑफ द पेशेंट्स जो आते हैं, मोस्ट ऑफ द हार्ट अटैक पेशेंट्स जो आते हैं, वो आके उनका कंप्लेन यही रहता है कि छाती में बहुत दर्द हो रहा है और मुझे गैस हो गया है. ठीक है, क्यों? क्योंकि जो पेन होता है हार्ट अटैक का, इट इज सिमिलर टू द पेन ड्यू टू गैस और एसिडिटी. गैस या एसिडिटी का जो पेन होता है वो भी हमारा थोड़ा छाती में तो एग्जैक्टली नहीं होता है, लेकिन ऑन द अपर पार्ट ऑफ आवर स्टमक, isn't it, अपर पार्ट ऑफ द एब्डोमेन में ज्यादा होता है गैस का जो पेन होता है. तो इसलिए बहुत पेशेंट्स को ये लगता है कि मुझे बहुत ज्यादा गैस या एसिडिटी हो गया है, और वही कंप्लेन लेके लोग आते हैं, लेकिन एक्चुअली में देखा जाता है कि उनको गैस या एसिडिटी नहीं हुआ है, उनको हार्ट अटैक हुआ है. ओके, so that is the importance of this sentence. It may feel like indigestion. Moving on to the next important disease, I21, that is AMI or acute myocardial infarction, जिसको आम भाषा में हार्ट अटैक बोलते हैं. ओके, Okay, so it is a disorder characterized by gross necrosis of the myocardium. This is due to an interruption of blood supply to the area, complete blockage of blood flow through one of the coronary arteries, usually from coronary atherosclerosis. Atherosclerosis is deposition of fat on the coronary arteries. Each year, over 1 million people in the United States have a heart attack. About half of them die, and the symptoms will include chest discomfort, which will include pressure, squeezing, or pain. Shortness of breath will be there, discomfort in the upper body, including arms, shoulder, neck, and back, nausea, vomiting, dizziness, lightheadedness, and sweating. Moving on to the next important disease that we need to talk about, the code for which is I00-I99, and the name of the disease will be chronic ischemic heart disease. Okay, so it is also known as stable angina. Occurs when the heart's blood supply is reduced to narrowed coronary arteries, usually from atherosclerosis. This condition leads to recurrent chest pain or discomfort, particularly during physical activity or stress, when the heart's oxygen demand increases. Managing chronic ischemic heart disease involves lifestyle changes, medications, and sometimes surgical procedures to improve blood flow. Long-term management is crucial to prevent progression to severe cardiovascular events like heart attacks. Okay, now moving on to the next important set of subcodes, that is I26 to I28, which refers to pulmonary heart disease and diseases of pulmonary circulation. So, इसमें the first most important disease that we need to talk about is pulmonary embolism. The code for which is I26. So, it is a sudden blockage in a lung artery. The cause is usually a blood clot in the leg called a deep vein thrombosis that breaks loose and travels to the bloodstream to the lung. So just सोचो हुआ है लेग में, वहां से वो जाके हार्ट को अफेक्ट कर रहा है. Okay, so anything can happen inside our body basically. Pulmonary embolism is a serious condition that can cause permanent damage to the affected lung. So there will be low oxygen levels in your blood, damage to other organs in your body from not getting enough oxygen. Symptoms of a blood clot will include warmth, swelling, pain, tenderness, and redness of the leg. The goal of treatment is to break up the clots and help keep other clots from forming. Next important set of subcodes that we need to talk about are I60 to I69, which refers to the cerebrovascular diseases. So let's see what are the different subcodes that we have. I60 will stand for non-traumatic subarachnoid hemorrhage. I61 will stand for non-traumatic intracerebral hemorrhage. I62 will stand for other and unspecified non-traumatic intracranial hemorrhage. I63 will stand for cerebral infarction. I65 will stand for occlusion and stenosis of pre-cerebral arteries not resulting in cerebral infarction. I66 will stand for occlusion and stenosis of cerebral arteries not resulting in cerebral infarction. I67 will stand for other cerebrovascular diseases. I68 will be cerebrovascular disorders and diseases classified elsewhere. I69 will be sequelae of cerebrovascular disease, means the after effect or the consequence. तो इसमें बस एक ही मैं हाईलाइट करूंगी, I63 के बाद डायरेक्टली आ रहा है I65, यानी कि I64 नहीं है. तो दिस इज समथिंग यू नीड टू रिमेंबर, अदरवाइज द अदर्स आर इन chronological order. Okay, now moving on to the important subcode that we need to talk about, that is I60, which stands for non-traumatic subarachnoid hemorrhage. So it is bleeding into the intracranial or spinal subarachnoid space, mostly resulting from intracranial aneurysm rupture. It can occur after traumatic injuries like subarachnoid hemorrhage हो सकता है या फिर traumatic injury हो सकता है. Clinical features will include headache, nausea, vomiting, nuchal rigidity, variable neurological deficits, and reduced mental status. What do you mean by nuchal rigidity? It's rigidity or stiffness in the neck region, back of your neck. Okay. Next is I61, which stands for non-traumatic intracerebral hemorrhage. So it is bleeding into one or both cerebral hemispheres, including the basal ganglia and the cerebral cortex. It is often associated with hypertension and craniocerebral trauma. Okay, moving on to the next important subcode, that is I63, which stands for cerebral infarction. So it is an ischemic condition of the brain producing a persistent focal neurological deficit in the area of distribution of the cerebral arteries. Infarcts of the cerebrum are generally classified by hemisphere, that is left or right. Lobe, that is frontal lobe infarction हो सकता है. Arterial distribution, that is example infarction, anterior cerebral artery, and etiology means कहाँ पे हुआ है, that is embolic infarction. Okay. Moving on to the next important set of subcodes that we have, that is I70 to I79, and they are referring to diseases of arteries, arterioles, and capillaries. Okay, So let's see what are the codes. I70 will stand for atherosclerosis. I71 stands for aortic aneurysm and dissection. I72 for other aneurysm. I73 for other peripheral vascular diseases. I74 for arterial embolism and thrombosis. I75 for atheroembolism. I76 for septic arterial embolism. I77 for other disorders of arteries and arterioles. I78 for diseases of capillaries. I79 for disorders of arterioles, arteries and capillaries in diseases classified elsewhere. So इसमें देखो everything is in chronological order, so no exception. So starting with the most important code that we have under this section, that is I70, which stands for atherosclerosis. So it is a thickening and loss of elasticity of the walls of arteries that occurs with formation of atherosclerotic plaques within the arterial intima, means on the interior of the artery of the heart, obviously. So it is a disease in which the plaque builds up inside your arteries. It is a sticky substance made up of fat, cholesterol, calcium and other substances found in the blood. Over time, the plaque hardens and narrows your arteries, that limits the flow of oxygen-rich blood to your body and can lead to serious problems including coronary artery disease. These arteries supply blood to your heart. When they are blocked, you can suffer angina or a heart attack. Or you can also suffer from carotid artery disease. These arteries supply blood to your brain. When they are blocked, you can suffer a stroke also. Peripheral arterial disease भी आ सकता है इसके अंदर. So these arteries are on your arms, legs and pelvis. When they are blocked, you can suffer from numbness, pain and sometimes infections. Moving on to the next important code that we have, that is I71, which stands for aortic aneurysm and dissection. So it is an abnormal bulging or ballooning in the wall of the aorta, which is the major artery carrying blood from the heart to the rest of the body. If the aneurysm becomes too large, means if the bulging becomes too large, then it can rupture, leading to life-threatening internal bleeding, means hemorrhage. Aortic dissection will occur when there is a tear in the aortic wall, causing blood to flow between the layers of the wall and potentially leading to rupture or decreased blood flow to the vital organs. Both conditions require prompt medical attention and may involve surgical intervention to prevent fatal complications. Next important code that we need to talk about is I74, which stands for arterial embolism and thrombosis. So it refers to conditions where blood flow in an artery is blocked, leading to tissue damage or death. An arterial embolism occurs when a blood clot or other debris travels to the bloodstream and lodges in an artery. Thrombosis, on the other hand, is the formation of a blood clot within an artery. Both conditions can cause sudden and severe symptoms such as pain, numbness, and loss of function in the affected area, and require immediate medical intervention to restore blood flow and prevent serious complications. Next important code that we need to talk about is I75, which stands for atheroembolism. So it is blocking of a blood vessel by cholesterol-rich atheromatous deposits, generally occurring in the flow from a large artery to small arterial branches. It is also called arterial embolization or atheroembolism, which may be spontaneous or iatrogenic. Patients with spontaneous atheroembolism often have painful cyanotic digits of acute onset. Next important code that we need to talk about is I76, which stands for septic arterial embolism. So it occurs when a blood clot containing infectious agents such as bacteria or fungi travels to the bloodstream and lodges in an artery. This condition not only blocks blood flow but also introduces infection to the affected area, obviously because infectious agent hai usme, leading to severe tissue damage and potentially life-threatening complications like sepsis. Sepsis means blood infection. Symptoms will include certain pain, fever, and signs of localized infection. Prompt medical treatment, often involving antibiotics and sometimes surgical intervention, is essential to manage the infection and restore proper blood circulation. Last code that we need to talk about will be diseases of capillaries, the code for which will be I78. So capillaries are what? Tiny blood vessels which will be connecting the arteries and the veins. So they can significantly impact the body's microcirculation. Conditions such as capillary leak syndrome, diabetic microangiopathy, and vasculitis can lead to increased permeability, damage to the capillary walls, and impaired blood flow. These diseases often result in symptoms like edema, tissue damage, and organ dysfunction due to inadequate oxygen and nutrient delivery. Effective management will depend on addressing the underlying cause and may include medications, lifestyle changes, and monitoring for complications. Okay. So I think that's it in this session. Soon we will be moving on to the next session of medical coding. Till then, thank you and goodbye. Please like, share and subscribe ITLS Academy.